Well, hi there, everybody. It's Dr. Steve here with Kineci, and here we are into understanding your pain. And today we're going to talk about an Achilles tendinitis. So an Achilles tendinitis is where it's getting the Achilles tendon that attaches to the heel. And let's do a little bit of education here. So here is our model of the foot, and this little blue patch is where it shows that the Achilles tendon comes down and attaches into the heel. So that is attached to the whole calf muscle, but that Achilles tendon comes down, it attaches into the heel, and then that tissue is continuous as it wraps around the underside of the foot, to the bottom of the foot. Very similar to the plantar fasciitis that attaches on the bottom of the foot, but that tissue is pretty continuous from the plantar fascia up over the heel, up to the Achilles, and then the Achilles attaches to the couple of muscles, the gastrocnemius and the soleus muscle. So some signs and symptoms of having an Achilles tendinitis is where there's pain at the heel or just above the heel where the Achilles tendon is attaching into the heel in the foot. There can be a lot of tightness and stiffness in the calf. Very often there's a lot of pain with stepping downstairs if you're trying to step down, or if you're trying to take a long step, the Achilles in the back will be painful and it'll make you take a shorter step. And some of the other common signs and symptoms that we see are sometimes it will be more painful the first few steps after you've been sitting for a while. So if you've been at the computer, you've been sitting at your desk, and then you go to get up and move, those first couple of steps, ouch, are a bit more painful. So we are going to go into working on things. And the first thing that we're going to do, the one other piece of education that I wanted to give you is about improving your Achilles tendon. And to get over a tendinitis, we want to do eccentric lengthening. So what that refers to is when the tendon coming down the back of the leg, when that's lengthening, when it's stretching and the muscles are turning on, they're contracting, but they're lengthening, what's happening is it's called an eccentric contraction. And that's where we get more tension through the connective tissue, the tendons, the ligaments, the fascia. But to strengthen the tendon and that connective tissue, we want to do things where we're lengthening through that tissue. So here we're going to start with our first little series of movements. So these are going to be some reaches, and so we're going to use the chair seat as a target, and I'm going to give you the example of, we're going to be focusing on my left leg to begin with here. And so we're going to do these on both sides, but this is going to be showing the left leg because that's the easiest one to see here. But what we're going to do is have a target out in front of us. A chair and the chair seat is a great target, but we're going to stand with 1 foot forward, 1 foot back. We want to keep the heel down onto the ground as best you can, but then everything is going to bend and you're going to reach to touch the target and come back up. So as we reach and bend, here we're getting this bend at the ankle called dorsiflexion. We're getting the lengthening through the calf in the Achilles. And so what we're going to do is some bending and reaching, being sure to stand up nice and tall in between each one. So we're going to do that on both sides, but we're going to do it this way. Starting with the toes pointed forward, then I want to have you do a set with the toes pointed out. So now the toes are pointed out. It's going to be the same bend and reach to standing nice and tall. You'll do a number of those, and then we're going to angle toes in. So it's going to be the same thing. The toes in is the harder direction because of how the ankle joint lines up and the shape of the bones and the joints. The toes in version is the more difficult direction. And if I give you these examples from a back view so that you can see, So the first set, we have the toes pointed forward. The second set, we turn the toes out. And then the third set, we turn the toes in. And you'll do a number of reaches for each of those three positions. Be sure to do both feet, and then also be sure to tune in for part 2, where we're going to go into taking it a little bit further to help you get over this Achilles tendinitis pain and understanding your pain so you can take control, feel better, and function better. If you or anybody you know are struggling with some pain and having your Achilles holding you back, don't sit there and suffer. Come on in, let us take a look, let's figure out a plan and get you back in action. Okay, until next time, keep moving everybody.